This presentation explores the Vietnamese culture and provides guidance for the healthcare professional to provide culturally competent care for members of the Vietnamese culture. The theoretical framework we chose to guide us through this cultural assessment was the Purnell Model of Cultural Competence by Larry Purnell. This model was used as a guide as we evaluated the culture and created culturally competent interventions for care. The Purnell model, as depicted in this diagram, has a unique construct that shows how all of the included parts interact. Starting from the outside of the circle, the order is the outer rim representing global society, the second rim representing the community, the third rim representing family, the inner rim representing the person, the interior wedges depict the 12 cultural domains of focus, the center is empty representing what we do not yet know about the culture, and the sawtooth line below the circle represents concepts of cultural consciousness. The inside of the circle is divided into 12 wedges representing the 12 cultural domains of focus as listed here. It is not intended for the domains to stand alone, rather they all affect one another. The concepts of cultural consciousness are represented by a sawtooth line beneath the circle for this model and are defined as follows. Unconsciously incompetent is not being aware that one is lacking knowledge about another culture. Consciously incompetent is being aware that one is lacking knowledge about another culture. Consciously competent is learning about the client's culture, verifying generalizations about the client's culture, and providing culturally specific interventions. Unconsciously competent is automatically providing culturally congruent care to clients of diverse cultures. Now we are going to review some of the demographical information regarding the Vietnamese culture. Vietnam is located on the eastern coast of Southeast Asia, bordered by China to the north, and the South China Sea to the south and east, and then Laos and Cambodia to the west. The country consists of extremely varied terrains, from mountainous regions to forests, coastal plains, and river deltas. In 2002, the population in Vietnam totaled approximately 80.5 million people. 13% of them reside in the mountainous regions, and the rest amongst the 3 main deltas and other major cities. Vietnam is also home to a variety of ethnic groups that exist within the Vietnamese culture. This is a list of the 12 main ethnic groups within Vietnam. We will now begin our exploration of the Vietnamese culture by learning about their various cultural characteristics and discussing implications for culturally competent care based on this information. Time orientation can vary greatly from culture to culture. The Vietnamese culture is a mix of both present and past oriented. They rely on many of their traditional values that are rooted in Confucianism from thousands of years ago, but are also moving towards a more market economy, satisfying their needs in the present. They will not be punctual for social gatherings in order to not appear overly excited or anxious for the event. They will, however, be very punctual for professional appointments, such as with their doctor, out of respect. The Vietnamese culture is very spiritual, and many are very devoted to their religion. 90% of Vietnamese persons practice Buddhism. Buddhism encompasses a variety of traditions, beliefs, and practices largely based on the teachings of Buddha, meaning the awakened one. Other practices commonly seen are Confucianism, which is based on a code of behavior and believes that man creates his own destiny. Taoism worships many gods and values simplicity, patience, and contentment. Catholicism, although present, results in many being persecuted for their beliefs. And animism is the worship of ancestors, astrology, and natural forces. Those that practice animism tend to be very superstitious. Implications for culturally competent care include knowing that many Vietnamese religions correlate sickness with supernatural factors. Many will consult with priests rather than medical doctors in times of illness. The nurse must encourage patients to seek medical assistance along with their supernatural aid to promote the best possible outcomes. Mental illness is also a concern, as many are shamed by the diagnosis and feel it is caused by bad karma. This means that the individual feels they became mentally ill due to doing bad things in his or her life or in a past life. They may not seek help due to high stigma within their community. Unfortunately, many Vietnamese refugees in the United States will exhibit somatization disorders. Nurses must be aware that a mental illness diagnosis may cause great distress to the patient. They can help by offering support and providing education to the patients in their primary language. Now we will review communication practices in the Vietnamese culture. The Vietnamese is a collectivist culture. This is conveyed through their verbal communication via their efforts to promote harmony within their conversations. Oftentimes, the Vietnamese will avoid saying no, sharing a difference of opinion, and using a loud tone. Vietnamese women tend to speak softly because it is considered to be more polite. Overall, in verbal communication, the Vietnamese culture goes out of their way to avoid offending the people they are speaking with. Members of this culture may convey a different picture of what is going on with themselves and how they truly feel out of respect or to please the healthcare professional, as that is considered of higher importance than the individual's own feelings. It's important for nurses to focus on obtaining continuous feedback from the patient regarding how they feel. The nurse should also verify patient's understanding or agreement due to their dislike of saying no. In the Vietnamese culture, in situations where verbal communication could cause more harm than good, nonverbal communication is used. Body language is an important part of the Vietnamese culture. Some body actions that are considered disrespectful are placing the hands on your hips or in your pockets, or patting an elder on the back. A sign of respect is to avoid eye contact, and bowing conveys great respect. The Vietnamese will often smile even when others consider it inappropriate. This does not mean that they are happy. It tends to be a way to avoid conflict. They find it rude to summon someone with a hand gesture where the hands and fingers are pointed upward. The Vietnamese culture associates this sign for an individual of a lower status or an animal. To summon an individual who is of the same social status, hands and fingers must be pointed downward. In regards to nonverbal communication, nurses must be mindful of their body language at all times to avoid offending or alienating their patients. When communicating with the Vietnamese, it is important to not misinterpret their body language as well. The Vietnamese are very mindful of their speech, and they tend to think before speaking to avoid causing harm or disrespect. Be patient and allow them enough time to respond to questions appropriately, and utilize the silence as needed. Generally, a greeting between men will be a handshake, and for women, a bow. It is important to respect the personal space of people of the opposite gender. Women may refuse gynecological exams due to modesty or at least require a female provider. The head is considered sacred, and you should avoid touching the head when possible. A Vietnamese patient may consider it insulting if you do not start your physical exam at their head and move towards their toes. This is because the head is considered to be the highest and most important part of the body, so it should be honored. Spatial distance, also known as proxemics, is essentially saying what someone considers their personal space. Strangers are considered unwelcome in a Vietnamese person's space. They may be very uncomfortable standing anywhere near someone that they do not know. When it comes to family, the distance of comfort for them actually narrows greatly to 0 to 3 inches, as they prefer to be very close to their loved ones. Women prefer to keep more space than men do, particularly between themselves and men, while men will prefer to stand very close to one another. When providing care to a Vietnamese patient, the nurse should always ask a woman before starting a physical exam and inquire if she prefers a female physician. A male should also be asked, as he might require a male provider. Avoid touching the patient's head unless it is entirely necessary for what you are doing. Do assessment from head to toe to honor the head as the highest and most important part of the body. Always ask permission before entering the patient's personal space, and make your intentions known before there is any physical contact. 2 important cultural sanctions are modesty and privacy. Modesty is very important, as personal humility is deeply valued in the Vietnamese culture. They do not readily demonstrate knowledge and will avoid bragging, as it can be offensive, and they may often decline to accept praise in many instances. Privacy is also very important. They may not share information that they believe may bring their family or themselves shame, such as with domestic abuse. Substance abuse may also remain a family secret. Any perception of wrongdoing brings embarrassment and shame to the entire family, not just a given individual. So, in order to protect a family's reputation, patients may not share information that can be important to the healthcare professional. When nurses are caring for Vietnamese patients, it's important that they know the patient may not readily demonstrate their knowledge. They might need to specifically ask them to show or demonstrate what they know when providing education. The nurse should avoid excessive amounts of praise, or they might make the patient feel uncomfortable. Do not brag about yourself, or the patient might also be offended. Always be sensitive when questioning Vietnamese patients about personal matters. This can be very sensitive for them, and you need to be persistent when seeking the information that is valuable to their care. Emphasize that you are trying to help them and that you can be trusted as an individual. The Vietnamese family is patriarchal, and oftentimes you'll find 2 to 4 families or generations living under one roof. Immediate family generally consists of the nuclear family, plus the husband's parents and any of the grown sons, spouses, and children. Extended family is the immediate family plus family members of the same name and relatives residing in close proximity. The roles within the Vietnamese family are very standardized. The father and other family members educate the children on filial piety. This is a key part of Vietnamese culture, and they start this teaching at a very young age. It requires that children give parents and elders respect, love, and care. The family unit is extremely important to the Vietnamese, and all members are expected to work and behave for the good of the group. Husbands are responsible for managing money and supporting the family members. They oftentimes are the one that work outside of the home and in certain occasions will speak for their wives when answering questions. The wives tend to be responsible for domestic duties and for the raising of the children. Grandparents that live within the home might also be in charge of helping with the child care. Children are to help with chores, and they will help with their younger siblings to teach them respect and to obey the older siblings. Aunts and uncles tend to be treated as parents, with the above same rules applying. The family unit is extremely important to the Vietnamese culture. They have an emphasis on collectivity that includes an obligation to provide for the welfare of the family members. Family members are expected to work and behave for the good of the group, and many families will publicly denounce a member who is ill-behaved. The father or oldest male has the ultimate responsibility and acts as an authority leader within the family and for decision making. That being said, they will often delegate tasks and involve others in decision making. Within the Vietnamese culture, elders are highly respected and honored. All children are taught to obey them, and they tend to live within the home. There are few nursing homes in Vietnam, as when the elderly require care, they will live with their younger generations. In the United States, the elderly may also fear nursing homes, as many do not speak fluent English. It is only in rare situations that a senior citizen will reside in a nursing home, such as when they do not have family members left to support them. It's important that the nurse understand the roles within the culture to help identify when and who to address with medical questions. They must be aware that some healthcare decisions may be made on a collective basis and are under the guidance of an elder male from within the family. Be aware of how gender roles may change as the Vietnamese are assimilated into the United States culture. The nurse should also be aware that premarital sex is not socially accepted. They may need to address these types of questions to the individual without other family members present to give the most accurate answers. When addressing the elderly Vietnamese patient, do a slight bow of the head to show respect. Avoid using medical jargon that could confuse them and use simple terms and phrases. It is also beneficial to have a translator with their primary language. Let's move on to the pregnancy and childbearing customs of the Vietnamese culture. In Vietnam, prenatal care tends to be lacking, and traditional practices are used to ensure a safe and healthy delivery. It is common for Vietnamese women in the United States to seek conventional prenatal care when pregnant. It is considered shameful and dishonorable to the family if an unmarried woman is pregnant. They may try to keep their pregnancy secret from family members for as long as possible. Sexual relations are believed to lead to respiratory illness or mental and physical deformations of the child during pregnancy. After birth, the baby's first cry is proof that the baby has a soul. The Vietnamese follow the Chinese calendar, and many believe that the child is already 1 year of age at time of birth. In Vietnam, traditionally, the husbands are not present in the delivery room. They will generally wait in the hall until the baby is born. The father being in the room is becoming more common now that they are in the United States. Women whose medical beliefs are based on the harmony of yin and yang often refuse to bathe, drink cold juice or water, or wash their hair in the postpartum period so as not to upset the hot-cold balance of their body. The theory is that blood which is hot is lost during delivery, so the body is at risk of becoming too cold or of getting too much air. During this cold period, the woman needs to be warmed up. This is accomplished through the ingestion of spicy foods and warm beverages. It might also be beneficial to offer the woman a heated blanket. The nurse should support unmarried pregnant patients and encourage them to seek prenatal care. They may be lacking support or possibly be hiding their pregnancy from their families. Allow the family to bring in foods from home while the mother is in the hospital. If this is not allowed, you should offer a nutritionist to assist in finding meals to meet their cultural needs. You may also need to offer warm blankets and hot beverages to the mother after delivery. Vietnamese mothers may extend their absence from work after giving birth to raise their children. Many of them will remain at home until their child is old enough to attend school, generally between the ages of 4 and 5. Grandparents are expected to help with the childcare, and children are expected to help with the chores around the home. The Vietnamese take their responsibility to teach their children very seriously. Their first priority is to teach obedience and respect, and the second is to provide as much educational success as possible. Children are expected to sit where their parents place them, and this expression characterizes Confucian-based parent-child relationships. In Vietnam, corporal punishment was the norm. However, in the United States, this is not accepted, so their methods of discipline have changed. This has led to harder control of their children and much frustration within the community. Nurses should help parents find educational programs to help with different discipline methods, enforce praising for good behavior, and ideas on how to discipline without yelling for negative behaviors. Help mothers find community resources for while on maternity leave, as this may cause financial hardship. We're now going to discuss the nutrition of the Vietnamese culture. Traditionally, Vietnamese follow a very healthy diet. Their meals emphasize rice, vegetables, and fish, and their cooking methods often involve steaming or stir-frying. It is generally rare to find an overweight adult who has grown up with the traditional Vietnamese diet. It is, however, changing for the young adults who have been exposed to high-calorie junk foods. For many adults, all 3 meals of the day may consist of steamed rice with side dishes of vegetables, fish, or other meat. Although fish is eaten the most often, in the United States where meat is cheaper, pork and chicken are becoming more popular. Common vegetables are cabbage, Chinese broccoli, mustard greens, collard greens, and cucumbers. A common condiment is a fish sauce made from salted and fermented anchovies. Use of MSG is also very common in their cooking. Vietnamese desserts often include coconut milk or coconut oil, both of which are very high in saturated fat. Many Vietnamese lack calcium since milk, dairy products, and soy products are not a part of their regular diet. Many Vietnamese adults are also lactose intolerant, although many children growing up in the United States now are drinking milk. Their diet can also be high in sodium with its reliance on fish sauce and MSG as common condiments, and low in fiber due to their primary grain being rice. Most nutritional concerns within the Vietnamese culture are surrounding the children and those that are ill. Babies tend to not be breastfed because the parents believe that formula is more nutritious, and many mothers believe that breastfeeding will cause their breasts to sag. Chubby children are considered healthy and a sign of prosperity in the Vietnamese culture. Many parents may want to spoil their children by taking them to fast food restaurants often. They may not realize that fast food contributes to weight gain, and the children and teenagers in the United States tend to eat a more Americanized diet, including cereal for breakfast, pizza, and hamburgers for lunch and dinner. Fasting is most often used when people are sick. They believe it's best to drink only hot water and eat thin rice gruel, rice and water with a little salt, in order to rest the digestive tract. Nurses and physicians need to educate patients on the benefits of breastfeeding. They should help determine snack foods to avoid children becoming overweight now that they are exposed to higher fat snack foods in the United States. Provide educational information on how rice is turned into sugar during digestion process for diabetics. Encourage calcium supplementation, especially in women, to prevent osteoporosis. Assess for lactose intolerance when planning patient dietary care or if they are suffering from gastric ailments. Healthcare providers may want to also make sure that sick patients are getting enough nutrition while fasting. The photo on the left is a photo of how a family will traditionally form an honor guard and mourn the loved one together in their home. The photo on the right shows the family bowing in prayer after the body has been lowered into the grave. Vietnamese attach great importance to two traditional family obligations. One is caring for parents in old age, and the second is to mourn them in death. These duties are considered to be sacred. The traditional time of mourning for parents is 3 years, and it begins even before death is imminent. The entire family will assemble around the dying relative when death is imminent, and a strict silence is observed. The eldest son will record the last words of advice or counsel from the dying member. The eldest child suggests a name for the dying person, as it's considered unfortunate to continue with the same name after death. Men usually take the name Trung, meaning faithfulness, or True, meaning loyalty, and women are usually called Trin, which means devotion, or Thuan, which means harmony. Traditionally, the children do not accept the idea of death immediately and will perform 2 rituals in an effort to bring the parent back to life. First, they will place a chopstick between the teeth of the deceased and place the body on a mat on the floor in an effort to bring it back to life. The next rite is for the eldest son or daughter to take a shirt the deceased had worn in life and wave it in the air to call upon the soul of the dead to return to the body. Next, the descendants will perform the ceremonial cleaning of the body. They are bathed, which symbolizes washing off the dust of the terrestrial world. Money, gold, and rice are placed in the mouth of the dead to indicate that the deceased has left the world without want or hunger. The corpse is then wrapped in white cloth and placed in a coffin. Family will stay with the body as an honor guard until a favorable time for burial is selected. During the mourning period, a small piece of black or white fabric is worn every day after the funeral to signify mourning. This lasts for approximately 2 to 3 years. At every memorial service, family members will wear the mourning cloth that they wore at the funeral. On the 2nd or 3rd anniversary, these are burned to signify that the mourning period is over. During the mourning period, the bereaved are prohibited from marrying or wearing brightly colored clothing. When the formal mourning period is over, it is permissible for family to then plan major life changes such as marriage. Families still observe the anniversaries of the death each year after passing. Surrounding imminent death, do all you can to accommodate the family during the patient's final stages, as it is important for all of them to be present. Respect their wishes for silence and control the environment when possible. Discuss plan for care of the body with the patient's family before death to prevent disruption of their rituals. We will now discuss the health practices of the Vietnamese culture. The Vietnamese patient may attribute illness to supernatural or spiritual causes. These can include curses, sorcery, or violation of religious or moral principles. In addition, illness may be seen as punishment for offending a god, spirit, or demon. For illnesses to have a spiritual or supernatural cause, Vietnamese may seek assistance from traditional practitioners or Buddhist monks. They might also find that illness is due to a disruption of balance and harmony, or biomedical causes as defined by Western medicine. The Vietnamese patient will often consult one or more traditional practitioners to alleviate illness. In the United States, they may use a combination of traditional and Western healthcare practices. Some Vietnamese, especially new arrivals, may treat illness with self-care, self-medication, and herbal medicines. Some may choose traditional and natural remedies because of affordability and seek Western healthcare services only if the traditional methods fail. The concept of preventative medicine is not generally recognized within the Vietnamese culture, especially if the condition is not accompanied by symptoms. If symptoms are lacking, they may discontinue Western medications or self-adjust to smaller dosages because Western medicine is considered to be extremely potent. Eastern medicine is widely based on 2 major theories, yin and yang and the 5 elements. These 2 theories are often combined to explain a health condition. Yin and yang is the oldest and most significant theory. The importance is for balance between opposite states such as hot and cold and inaction and action. 5 elements is major organs are grouped into the elements of water, wood, fire, earth, and metal. Health is viewed as balance between these 5 entities, each depending on the other as well to regulate. Traditional practitioners in the Vietnamese culture include spiritual healers, physicians who employ herbal medication and acupuncture, and informal folk healers who use natural and pragmatic approaches such as special herbs and diets, and magicians or sorcerers. In the United States, Vietnamese may use a combination of traditional and Western healthcare practices. These are the three most commonly used traditional healthcare practices by Vietnamese persons living in the United States. Many have particular implications towards nursing care and will require some special knowledge and understanding to be culturally sensitive. Coining, which literally means rubbing out the wind, is used to restore balance by releasing the excess force or wind from the body. Ointments or mentholated oils are rubbed across the skin, usually on the back, chest, or shoulders, with the edge of a coin. This technique is used to treat colds, sore throats, flu, sinusitis, and similar ailments. The firm strokes bring blood under the skin and result in mild dermabrasion. Coining, although not generally uncomfortable, can result in mild dermabrasion. These marks can be mistaken for signs of abuse if not recognized appropriately as seen in these photos. Interviewing the family and assessing their cultural background can help you distinguish between abuse and cultural practices. Acupuncture is where a specialized practitioner inserts small needles into vital energy points of the body that correspond to specific organs. Acupressure is similar to acupuncture, as the vital energy points are stimulated by pressing or massaging to maximize their therapeutic effects. These practices are used for healing or to restore balance and to increase energy flow. Although rare, there are some safety concerns related to acupuncture. There is a mild risk of injury or infection due to the invasive nature of the therapy. Please note that injuries to vital nerves and structures are rare among patients treated by trained practitioners. Nurses must encourage the use of trained practitioners and make patients aware of the risks surrounding non-sterile needles. Laws require that the needles used for acupuncture be sterile, disposable, and only used once. There is a risk of passage of infections that can be carried on needles if reused. These include hepatitis B and C and HIV infections. The second risk is due to omission of allopathic and traditional care. This may lead to inadequate diagnosis or treatment of conditions. Nurses should encourage patients to consider this a complementary therapy rather than an alternative therapy. Medicinal herbs are boiled in water or mixed with wine and consumed to restore balance and to treat a variety of maladies. Packaged medicines are herbal medicines that come in a variety of traditionally prepared pills or liquids and are taken for prescribed ailments. Nurses need to know if a patient is taking any herbal medications because certain herbs can interfere with standard medications. Garlic, which is taken for the heart, and ginkgo, which is taken to improve memory, can increase the effect of blood thinners, while golden seal, often taken to treat colds, can decrease the effectiveness. St. John's wort, an herb commonly used to fight the winter blues, can also render birth control pills ineffective. Nurses need to record and be able to find information regarding every herbal and over-the-counter medication their patient is taking to prevent interactions with prescribed medications. This is a brief overview of the incidence of disease within the Vietnamese culture. The chart on the right is provided by the World Health Organization and shows a visual distribution of deaths caused by the most common non-communicable diseases, communicable diseases, perinatal, maternal, and nutritional conditions. The most common non-communicable diseases were cardiovascular disease, cancer, respiratory diseases, diabetes, and injuries. Of the cancers, liver cancer had an incident rate 6 times that of a non-Latino white. The increased incident has been widely associated with there being higher rates of hepatitis B infection. Cervical cancer had a higher rate than any other racial or ethnic group. The higher rate is thought to be caused from traditional health beliefs and risk factor knowledge that contributes to low cervical cancer screenings. The most common communicable diseases were hepatitis B and tuberculosis. Chronic hepatitis B and hepatitis B-associated liver cancer are major health disparities among Vietnamese Americans, with a chronic hepatitis B prevalence rate of 7 to 14% and an incident rate of liver cancer 6 times that of non-Latino whites. Among Asian Americans, infection usually occurs in childhood, leading to liver cancer at earlier ages. Hepatitis B accounted for 80% of liver cancer cases, and 2/3 of Asian Americans chronically infected with hepatitis B virus were unaware of it. Early diagnosis through blood tests is crucial as it can lead to treatment with antiviral medications and preventative measures such as avoidance of alcohol and liver toxins, vaccination for hepatitis A, and possible screening for liver cancer. We also want to promote prevention by vaccination of patient contacts. The evidence-based practice article we reviewed was a study regarding hepatitis B knowledge amongst Vietnamese Americans. 1,704 Vietnamese Americans were surveyed via telephone regarding questions about hepatitis B-related beliefs, knowledge, and behaviors. Listed here are our statistics found from that survey. They found that factors associated with a lack of testing included having lived in the United States for greater than 10 years, speaking Vietnamese less than fluently, having a lower household income, and thinking that hepatitis B virus can be deadly. One possible explanation may be that efforts to promote testing and vaccination in the United States have been focused more on recent immigrants. Since 1996, U.S. immigration laws have required hepatitis B vaccination for those applying for immigration to the United States. Factors most strongly associated with testing were physician recommendation and patients requesting for the test themselves. Nurses must be informed of the risk factors associated with hepatitis B and know when to recommend hepatitis B testing. Informing Vietnamese Americans about hepatitis B and empowering them to ask their physician for the test may be one way to increase the rate of hepatitis B testing. Assist physicians to offer the test in a culturally appropriate manner to this patient population. Screen patients for immunization history if hepatitis B testing is negative. Immunization is the best option to prevent the spread. Encourage parents to immunize their children. Vietnamese Americans' cervical cancer is 5 times higher incidence than the white female population of the United States. Vietnamese American women aged 55 to 65 years have a cervical cancer rate 10 times higher than that of white women of the same age in the United States. Despite the proven benefits of Pap testing in the early detection of cervical cancer, Vietnamese Americans report lower usage of Pap testing. Factors contributing to poor screening can be broadly summarized into 3 categories: lack of knowledge and misinformation about cervical cancer, psychosocial beliefs about cervical cancer and perceived barriers to screening, and structural barriers to healthcare access. Common barriers to Pap testing in the general population include fear, embarrassment, cost, transportation, communication, lack of healthcare provider referral, and lack of time. Studies have found that Vietnamese Americans have additional barriers that include unmarried marital status, younger age, lower level of education, living in the United States for less than 15 years, lack of insurance coverage, limited English proficiency, limited knowledge about cervical cancer and benefits of Pap tests, and the lack of a female physician. In addition, the stigma associated with extramarital activity in Vietnamese culture can deter unmarried women from getting Pap smears. The evidence-based practice article we reviewed did a study regarding the underutilization of cervical cancer screening. The study baseline showed that 53% of Vietnamese Americans had ever had a Pap test. In terms of the perceived benefits of Pap tests, about 50% of the participants believe that Pap tests are the best way to detect cervical cancer. Cervical cancer can be easily treated if detected early, and a Pap test is important for staying healthy. Women who perceived these benefits were 2 to 4 times more likely of ever having had a Pap test compared to those who did not. More than half of the participants experienced some access barrier to obtaining a Pap test. Their study findings are listed below as the most frequently perceived physical barriers and the most frequently perceived psychosocial and cultural barriers to Pap tests. Involve family members, including the male relatives, in education why Pap testing is important. Vietnamese Americans hold relatively conservative views about sexually related health topics, and many women will require the permission and support of their male relatives to seek gynecological care. Adapt programs to recognize Vietnamese American women's traditional beliefs while encouraging them to adopt new health preventative concepts into their daily life. Provide education and educational handouts in the patient's native language. Facilitate patients in making appointments as language barriers discourage them. Make patients aware of financial assistance for cervical cancer screening, such as the All Women Count program in South Dakota. This cartoon is an example of why it is important to educate, and educate our patients so they will make informed health decisions.